Welcome, everyone. It looks like you are in the process of logging on to today's Missouri Open Door Benefits Series webinar. Today, our topic is Medicare Open Enrollment. My name is Catherine Reagan, and I am a Senior Research Assistant at the University of Missouri, Kansas City Institute for Human Development. And this series is sponsored by, if I can have that next slide, I want to get the title right, the Medicare Improvements for Patient and Providers Act, which is MIPA, Priorities 1, 2, and 3. And it's in partnership with Missouri SHIP, Missouri Department of Health and Senior Services, and the University of Missouri Kansas City Institute for Human Development, which is also the No Wrong Door designee. No Wrong Door's goal is to transform the way people access the services in their communities. And we do this by supporting individuals and caregivers to make decisions on complete and accurate information about their options for anyone seeking long-term services and supports, regardless of age, income, or disability. Our series follows the integrated support star. So our goal is to look at all services with which a person interacts. So starting with their own personal strengths and assets, their relationships, the eligibility specific supports, which is where this benefit series focuses, community-based supports, as well as technology, which is the focus of the Missouri Open Door Technology Series. This series, our next technology series date is October 25th, and that will examine assistive technology for employment, followed by assistive technology for hobbies and pets on November 15th. There will not be a call in December, as we are engaging with lots of holiday schedules at that point. So at this point, I will pass it on over to Gary, and he's going to take it away to talk about Medicare Open Enrollment.
All right, thank you, Catherine, and good afternoon. Thanks for sharing your lunch hour with us. Just want to introduce my partner in crime, Ben Franklin, who's a member of the Strategic Outreach Team, and my name is Gary Gummick, also a member of that team. Sonia Baskarin is on keyboard. She's kind of helping keep us moving and honest here, so we appreciate that. What we're hoping to accomplish today is really to go through everything open enrollment. So we want everyone to understand what it is, what changes can be made, and when. What special enrollment is all about, talk a little about Medicare Advantage and Medicare Part D drug plans. Really, a lot of the time is going to be spent on Medicare.gov Plan Finder, because we think that's probably the most practical way that we can provide you the ability to analyze plans for yourselves. We want to go through that, and in addition to using a case study to kind of help reinforce how to go about it. So we're excited about this, so we'll get started. So we'll start with who Missouri SHIP is. We're the State Health Insurance Assistance Program, and formerly Missouri Claim. We rebranded about 3 months ago or so, but it was created by Congress as part of Medigap reform. And I know the 2024 books have just come out. And if you turn it on the back, you will see our Missouri SHIP and our phone number. So you can get a hold of us there. It's down there in the bottom right of this screen as well. So I encourage you to call us anytime you have a question. The important thing on Missouri SHIP is we don't sell or promote any insurance company or its products. So we are completely unbiased. We listen to what is important to you, and then we point you in the right direction with the education and analysis that helps you make a decision on how you get your Medicare. So that's an important part. So what is the annual enrollment period? So you hear about that. The annual enrollment period is really Missouri SHIP Super Bowl, if you will. The Chiefs will be in the Super Bowl this February, but we're just getting ready for our Super Bowl. So October 15th through December 7th each year is the annual enrollment period. And really, when you think about it, that's the time when people should be reviewing their Medicare, their Part D, A, B, that sort of thing, to see if they need to make a change, because that's the time where you can make the majority of your changes in this October 15th through December 7th. So, and those changes will become effective on January 1st the next year. So gives you plenty of time to kind of look over this and study it. One of the things that we're trying to change is this graphic from the Kaiser family. It's showing that more than half of the Medicare beneficiaries report that they don't review or compare their coverage options annually. And that's really just leaving money on the table, because the average amount that Missouri SHIP saved beneficiaries, for the ones that called in for their coverage, was right around $2,000. So that's a lot of money to leave on the table. So it's important to call, to review. You may not make any change. Everything may be the same, but you have that peace of mind that you made the right decision for you. You saved as much money as you could. So we encourage you during this time, call us, make an appointment. We can counsel you over the phone, and we can see, even if nothing has changed for you, it may have changed on the insurance company side. Okay, there's several enrollment periods, and we just talked about the open enrollment period, October 15th through the 7th, where anyone with Medicare can make a change. So there's also an open enrollment period for Medicare Advantage. So those folks that already have a Medicare Advantage plan can also make changes, one change, January 1st through March 31st. So really those with Medicare Advantage kind of get an extended period here to be able to make some changes. Initial enrollment period, that's really, from a definitional standpoint, most of the time that's aging in, turning 65. And it's really the 313, the 7 months, 3 months before your 65th birthday, and your birthday month, and 3 months after. So that's your initial enrollment period to enroll without, when you first become eligible, without penalty. General enrollment, if you happen to miss your initial enrollment period, you can enroll April 1st to June 30th. So you get another opportunity for that. And special enrollment, it really depends on eligibility. So special enrollment we'll talk a little bit about later, so I won't go into it here, but that one's just, for now, we're just going to say it depends. So what can you change during your open enrollment here? So if you're on original Medicare, or some people call it traditional Medicare, with parts A and B, you can switch to a Medicare Advantage plan. So you're able to switch to the Advantage plan. You can switch between Medicare Advantage plans. So if one Medicare Advantage plan got a lot better the next year, you can go ahead and switch, and those changes will become effective on January 1st. You can choose a Medicare Part D prescription drug plan, or you can switch plans. And that's the thing where each year, because the formularies change, I strongly advise you to make those review appointments each year to check that out. And if you're in a Medicare Advantage plan, you can switch or return to traditional Medicare. So really, you can go from Medicare Advantage to Medicare. You can go from Medicare to Medicare Advantage. If you are going to go from Medicare Advantage back to traditional Medicare, just make sure that you understand your guaranteed issue right for a Medigap plan, because that's the one thing switching back and forth. If you chose a Medigap plan out of the chute with original Medicare, and you're switching back and forth, you may not be able to keep that guarantee issue right. And we've talked about that in previous sessions, so I'm not gonna go into the details about that. Okay. So we talked about Medicare Advantage open enrollment period. And again, if you look at the left here on your screen, kind of the prerequisite for this is you have to be on a Medicare Advantage plan to take advantage of this Medicare Advantage open enrollment period. But again, you can switch plans or you can go to original Medicare. You can make one change in this period, and the change is going to be effective the first of the following month. So you don't have to wait long to see that change come through there. So Extra Help special enrollment period. So Extra Help is a program, a subsidy program from Social Security that helps with drug costs, with drug premiums, co-pays, co-insurance, and that sort of thing for limited income individuals. And if you are on Extra Help, that allows you to make some changes to your Medicare coverage really 3 times, once per quarter in the first 3 quarters there. And then you've got the open enrollment as well. So again, changes effective first of the month. And so again, you have a little bit more flexibility to change plan to plan if you're on Extra Help or the low income subsidy. So again, unless you qualify for a special enrollment period, October 15th through the 7th is your time. Again, your Super Bowl. And I think the latest stat I saw was that Missouri SHIP handles about 40 or 42% of all their calls during this time frame. So that gives you some idea of the volume that comes our way during this time frame. So there are exceptions to open enrollment. Again, if your coverage is disrupted for some reason, so say the company stopped selling that, moved out of the coverage area, whatever the reason, you lost your group health coverage, things like that, give you special enrollment periods. If there's a 5-star Medicare Advantage or Part D plan, you're able to have a special enrollment period to enroll in that. I personally haven't seen one of those yet, but I know in talking with Ben, he's seen one during his time at Missouri SHIP. So it does happen, just not very often. Changes in eligibility, and again, we talked about the LIS or Extra Help recipients can change plans outside of that open enrollment period. So again, things to know. So we thought we'd take a little bit, and unfortunately, as far as the cost changing, we were hoping by this time that CMS would have released specific costs that were going to be associated with both the premiums and deductibles, co-insurance and whatnot for 2024, but they haven't. So I won't take much time on this. You can see the 2023 cost. What they tell us is there's not going to be dramatic changes in costs for going from 2023 to 2024, but again, they just aren't out there yet, so we really can't provide much more information than that. So on the Part B, if we go to the next slide, you'll see kind of the rumor mill has it going $174.80 a month, which is up about $10. But again, that's still an estimate, but at least that one has been floated around for a while. And again, I haven't heard anything on the Part B deductible. Typically, these things don't go down very often. The Part B premium did go down from 2022 to 2023, but again, you're seeing it go back up to about where it was before. So I anticipate the cost to remain pretty stable, but increase some. So we want to talk just a little bit about Medicare Advantage. And again, from a cost standpoint, the Medicare Advantage programs really combine Part A, Part B, and most of them combine Part D, as in drug plan, into one package that they call Part C, or Medicare Advantage. And the projected change looks like, again, it's going to go up maybe $1 or so from 2023 to 2024. I will say there are a lot of Medicare Advantage plans out there with a zero premium. Still have to pay your Part B premium, but there's no additional premium on top to cover that drug plan and whatnot. So, I always suggest looking at those first, seeing how that kind of plays out. And again, you have the ability to switch, and CMS continues to fund Medicare Advantage plans pretty generously, and you can see that they're funding additional there. And that's really how they continue to be able to provide supplemental benefits like vision, hearing, dental, and that sort of thing. So what should you consider when you're in this open enrollment period and you're considering switching from a Medicare Advantage to original Medicare? You'll find that the costs vary. You've got in original Medicare and 80/20 coinsurance. So that's something to keep in mind, especially when it comes to a hospital stay. You go in for a week at the hospital and your bill could be hundreds of thousands of dollars. So 20% of that is a big number. So we always want to make people aware, if you go back to original Medicare, you probably would like to look at a Medigap plan just to cover that 20%. So, and that's great, but if you're outside your guarantee issue period, you may have to go through underwriting, and the company can choose to decline you or just charge you more than somebody your age because of medical conditions. So that's something to really keep in mind, that if you want original Medicare and the Medigap is important, make sure that you can qualify before you switch. And if you had a Medigap prior to switching to Medicare Advantage, you can be there's a grace period for that as well, that you may want to look at, that keeps that guarantee period for a year the first time you do that. Something to keep in mind. And again, don't forget to sign up for a Part D drug plan, because there are penalties associated with not signing up for parts of Medicare when you're first eligible. Now, if you're going to go the other way from original to Medicare Advantage, one of the big things, kind of probably top two, check the maximum out of pocket. So the Medicare Advantage have a limit to how much out of pocket you can pay in one particular year. So that's a good thing. So you want a low out of pocket if you can get it. And again, a main thing is, can you use the providers that you want to use? So that's important. Those two things are kind of paramount. The extra benefits associated with a Medicare Advantage, you just need to stop and think how much those are worth to you. Some of those are very, very nice, like dental, hearing, vision. Some have meal plans, transportation for non-medical and medical, things like that. So I guess read the fine print of the Medicare Advantage to understand exactly how much they cover, because most have limits on the extra benefits. Okay, and let's just take a second to check for understanding. So we're going to have a poll. And so if you choose a Medicare Advantage plan, is it true or false that you can never switch back to original Medicare? So go ahead and vote here in the poll if you think that's true or not. So if I choose a Medicare Advantage plan, I can never switch back to original Medicare. So false, 100%, 18 out of 18, very good. You can switch back to original Medicare. So you guys were listening, and that was great. So just key points as I get ready to close this out and pass it to Ben. Your costs are going to vary based upon your drug plan, pharmacies, tier of medication you're on. And so what Ben is going to show you is basically how to use the plan finder tool to see exactly what you're going to pay, or I shouldn't say exactly, an estimate of what you're going to pay based upon the pharmacies or based upon the plans that you choose. So I think you're going to find it very interesting, this next section. So I'm going to let Ben take it away.
All right. Thanks, Gary. First of all, let me make sure everybody's hearing me okay. The connection sometimes been a little iffy. Do I get a thumbs up on everybody? Okay, great. We're going to talk a little bit about some of the considerations with regards to Part D, and then we'll get into the detailed look at using the Medicare Plan Finder and what type of information that provides for us. So in terms of the prescription drug plan, which is what we call Part D, this we're estimating that the average cost is being projected at around $34.50. That's the premium, a monthly premium. In my experience, that's about typical, maybe a little bit lower, but it all depends a lot on the zip code, that type of thing, where you are, in other words. The deductible this year did go up a little bit. What that means is you would have some initial out-of-pocket expenditures when you're purchasing your medications where it would not cover the meds for a certain period of time until you met that. Now, that doesn't necessarily apply to every medication, and we'll see that when we look at the plan finder, because some of the lower generic medications, the plans may have a zero copay. So don't think necessarily that you're going to have that total out of pocket. It's going to depend on the medications. And again, we'll see that. In 2024, there's everybody's heard about the donut hole or a coverage gap. When you reach a certain amount that has been paid, then your cost, your copay goes up to a set amount of 25%. And then once it reaches another figure, then your copay changes again. And this coming year, in that last, what is called catastrophic phase, they have actually eliminated the copay there, so there would be no cost. Okay. One of the most important things that everybody needs to pay attention to at this particular time of year, if you have a prescription drug plan, meaning you probably have original Medicare that Gary talked about, where you have your Part A and your Part B, and then you have your Part D plan, and then you have your Medigap plan, the supplement. Or if you have an Advantage plan, which is often referred to again as Part C, you will get a notice, an annual notice of change. And what that annual notice of change is, it includes a description of any changes, and most of them will have on one side, here's what you currently have. On the other side, here's what your plan starting 2024 is going to do. That allows you to look very, very carefully at what you have and what it's going to be after January 1st. And that can be very, very important to you in terms of making some decisions about whether or not you need to compare and what you need to look at, what you might need to think about. So when do you get it? You should have gotten it. If you have not received that, or if by accident you filed it away permanently in the trash can, there are ways of getting a copy to look at. And you can also look at those changes on the plan finder. Who you're going to get it from? You're going to get it from the insurance company that is the underwriter for either your drug coverage or your Advantage plan. So as I always tell folks, you're going to get endless barrage of mail that has varying degrees of importance looking, so to speak. If it has the name of the company that underwrites your prescription drug plan or your Medicare Advantage plan, for goodness sakes, open it and look at it before you toss it. Okay, what should I do if I get the notice? I've talked about that. So things to consider. Sorry there, Sonia, got you going back and forth. Okay, let's go forward. So what am I going to think about in terms of prescription drug plans? Gary has talked to you about Advantage plans and some of the things to think about and look at. And considering whether or not you need to change a prescription drug plan, first of all, we always recommend to individuals that you consider comparing plans. I had a lady call me just the other day that I worked with last year and said, hey, it's time. I talked with her a little bit. We set up a time when we can get back together. And I said, have you had any changes in your health? Are you changing your medications? Her answers were no on all of those things. But she said, I'm really interested in those. She had an Advantage plan. I'm interested in those extra benefits. So you need to think about the coverage you have, and are you getting full benefit from what that coverage might have available for you. Another question you can ask is, should I switch pharmacies? And we can see that very clearly when we look at the plan finder here in a few minutes, because these insurance companies enter into agreements with pharmacies in terms of pricing and what their copay is going to be. In other words, how much you're going to have out of pocket, if anything. So that's very important. Sometimes whether or not it's the lowest monthly premium doesn't necessarily mean it's going to be the best policy. So you need to think about that, and then whether or not you might want to consider using mail order pharmacies, and how's the pricing. Sometimes mail order pharmacies are significantly different, and sometimes they're not. So here's what we're going to do. We're going to take Jeffrey, who is a young lad of about 67 years old, and he's currently on original Medicare. That means he's got his Part A and his Part B. He has a prescription drug plan, and he also has a Medigap plan, the one that covers that 20% that Gary was talking about a little bit earlier. So he's currently taking insulin, and he is also on Eliquis, lovastatin, and atenolol. So how are we going to help Jeffrey, and how are we going to look at helping him compare his current plan with what he might have available this coming year? Okay, next slide. So what we're going to do is we're going to go to Medicare's website, medicare.gov, and I'm not going to do anything this afternoon that you can't do on your personal computer. A little difficult to deal with when, okay. Are you seeing me okay? I assume the answer is yes on that, since I didn't hear otherwise. Okay.
Yep, I see it, Ben.
Okay. So when we click on that, everybody should be seeing my web page in good shape. This is what you will come to. As you can see, this is Medicare's website, medicare.gov. And this is a page that you can get started on doing a lot of different things. And there are tabs down here that will lead you to some very, very good information if you have questions or need a starter. Clicking on getting started with Medicare will walk you through some steps that are very good. But what we're going to deal with first today is getting into the actual plan finder. What I'm trying to say is there's a lot more on this website than just the plan finder itself. So if we click on this button, this takes us to a point where we can create an account if you don't have one. And as you can see, this is my website, and I do happen to have one. So if you click create on the account, it's simply going to ask you to enter some information, and those steps are fairly easy to follow. You'll need to have your Medicare card so that you can put the number in and the start date on it, and then it'll walk you through setting up the account and creating a username and a password. Okay, let me see if I can get over to the next tab. All right, so what we are going to do, I'm going to take a little quick shot and bypass some things here. We are going to look for health and drug plans this afternoon. So when it takes us to this point, now we're not logging in. The advantage of setting up your own account and logging in is that the information that we're going to enter can be saved if you have an account. Otherwise, every time you go in the way that I'm going to go this afternoon, because we can't set up a dummy account on Medicare's website, you would have to enter all this information anew. So the first thing that we're going to select is a zip code, because all of the plans and the cost and the pharmacies and everything are dependent on where you live. So we click on continue. It then asks us, what do I want to look for? Well, remember, Jeffrey is wanting to consider any changes and what might be the best plan for him next year under his prescription drug plan or his Part D plan. So we will select that. Then it will ask us some questions. Gary mentioned earlier about some of the possibilities of like getting extra help. So if you were eligible for that and receiving extra help, you would click that. In our particular situation, for Jeffrey, he does not get any type of assistance from those particular programs. But there are several listed here. We're familiar with Medicaid. The Medicare Savings Program is helps with premiums as well as copays. And then this is the one that applied to the extra help with drugs that Gary referred to. All right. Do you want to see your drug cost? And this is important to list here, because in order to compare plans, what the plan finder allows us to do is enter the medications that the individual takes. And that was the list back there that we talked about, or that he had, where he was taking the insulin and the Eliquis, the lovastatin, and the atenolol. So we're going to tell it yes. And at this particular point, then it asks us to enter the prescriptions drugs. To save time, I have done that already on some of them, and I'm going to do one more. And that is with the Humalog. So you just simply enter the name of the medication. It will bring up a box, and if it doesn't bring up the box, that means that that's not a covered medication. And typically that happens more frequently when it's an over-the-counter type of medication. So none of those are typically covered under your prescription drug plan. We add the medication, and you'll notice that it informs us that this drug has a generic form and wants us to make a decision about whether or not we should keep the brand name or whether we should go for the generic. And that's something that you would need to know. So one of the things that I should have told you from the very beginning is that in order to do this, you do need a list of your medications and the strength of them, how frequently they are given. In this case, we're going to assume that Jeffrey uses the generic. And so it puts that information in. There may be some options in terms of selecting. We're going to stay with just whatever comes up. But in terms of how the strength of the medication and how it's packaged and so on. So we're going to add that to our drug list. It does kick up a reminder, by the way, that starting a year ago, a cap was placed on insulin medication so that you do not have a copay of more than $35 each month on each medication that you might be taking. Now, remember that needs to be insulin, and sometimes it's a little surprise to folks because there are some medications for diabetics that are not classified as insulins. But in all cases where it is, then it will be, your copay will not exceed that amount. So once we get to this point, let's look and make sure that we've got our medications in. We've got the atenolol, we've got the Eliquis, we've got the generic form of the Humalog, and then we have the lovastatin. At that point, we are done adding our drugs, and we're ready to select pharmacies. And what it does is shows the pharmacies near or within that particular zip code. And if you don't get enough, if you live in a rural area, for example, you may need to expand that search to 10 or 20 miles, whatever it might be. So in terms of selecting for comparison purposes, I always tell folks, let's select the big box ones at a minimum so that we get a good idea. And then probably is a good idea to select a local pharmacy. And this would be one that you might be using now, or local pharmacy that you're really committed to and to service that they provide. So you can see it lists several all the way down through. So once we are completed with that, then we are ready to click on Done. And what that does is brings up all of the different prescription drug plans that are available in the zip code that we selected. And then we can go back and change that zip code if we wanted or got it wrong or needed to look at something different. So what this means is there are 35 different prescription drug plans available in zip code 65203. And you can typically find somewhere around 20 to 30 different plans that might be available. All right. What this is going to do then is list all of those plans, and it has already sorted them for us based on the cost and the premium. And what it's going to give is a projected estimated cost for the rest of 2024, which obviously right now would be all 12 months. So we can see that this particular plan, the AARP Medicare RX Preferred from United Healthcare, it estimates that this will be our total cost for those, our total out-of-pocket costs for those 4 medications for the remainder of the year. Keeping in mind, this one was $28.82. So as we scroll down, it will continue to show the plans that are available. Again, we would expect the amount total out of pocket to increase because remember, it has ranked them in that particular way. So let's just select a couple, our 3 here, and we'll look at some more of the details, see if I can select from different companies there. Okay. Once we get to that particular point, then we click on compare. And what it's going to show then is the 3 plans that we have selected. Now, if you were to log in and or set up an account and log in, the very first plan it's going to show in this particular box is going to be your current plan. So let's pretend for our purposes here that this might be the current plan that you have. So it shows side by side then what your plan would be, and then what the 2 other plans that we have selected amount to. It gives the premiums, and you can see there's quite a variation in the premiums for each of these 3 plans. And it shows the deductible. These 2 plans did not have a deductible. This particular plan does have. But here is the heart of the information that we're looking for. Here are the pharmacies that we selected back there when we were looking: Walmart, CVS, Kilgore's, and Walgreens, along with the mail order. So if this were your current plan, what we would see is that all of the pharmacies are pretty much the same. Some have a designation of preferred versus just in-network. There are essentially 3 relationships that pharmacies or insurance companies have with a pharmacy. One is preferred, which is the best. That means that's where you're going to get the best price. You're going to have the lowest out-of-pocket for that, for your medication typically. And you can see that these 2, which are in-network, are a little bit more. Sometimes the in-network varies a little bit. Sometimes it's more. The difference is not very much. It's negligible for all practical purposes. And the other relationship is out of network, meaning that the drug plan does not participate, or that pharmacy does not participate in that drug plan. And you would see the cost up in the several thousands of dollars in a situation like that. So if this is your current plan, then probably all 4 of the pharmacies are going to be very, very similar in terms of what your total out-of-pocket. Now, remember, this total out-of-pocket includes the cost of the drugs and the premiums for the remainder of the year. And again, in this case for 2024, that would be for all 12 months. So what we're trying to decide now is, does Jeffrey have the right plan? Here's his plan. Well, obviously, it's very quickly apparent that his current plan is not going to give him the best cost for 2024, because if he were to go to Walmart, this is going to be his total out of pocket. If he were to take this plan and go to Walmart, you can see that he has a substantial savings of around $1,200 a year. That's the importance of comparing plans and using this particular tool, because it very quickly can show us that here is the best plan. Now, let me show you. What do you notice about these three plans when we look at the premium? The high dollar premium is the best plan. Doesn't seem to make sense. Why? Because we are looking at the total drug cost plus the premium costs. So even though he's paying more per month for his premium, he's actually going to be paying less with this policy than he would with the one he currently has, because they have lower copays. Hope that makes sense, because that's certainly a very, very important thing to remember. All right. So our recommendation obviously would be that Jeffrey consider the possibility of looking at this plan and utilizing that. So let's look at some more details of the plan. That button that I just clicked then takes me to information that's more specific about this specific plan and the drug coverage. Again, here are our 4 pharmacies. And this is information that we have that we just looked at, broken down a little bit, showing us the estimated yearly cost of the medications, not the premium, just the medications. So it's very easy to pick out Jeffrey's high dollar drug, and that is obviously the Eliquis. So that's one bit of information you can get. If you scroll on down, it then will tell you that if he goes to Walmart, which again was one of the preferred pharmacies, this is going to be his total drug and premium cost, and he's going to get into the coverage gap, which we talked about a little bit, in August. And he's going to stay there the rest of the year. In other words, he will not get out of that. And what that means is we go and look at the monthly cost. We said August is when he went into the gap. Well, you can see that all along, before he got into that, his estimated cost, and these again are just looking at the cost of his drugs or medications, are going to be $96. And then when he hits the donut hole, his out-of-pocket expenditure for the medications is going to go up and stay pretty consistent, because that's when he's going to be paying roughly 25% of the cost. We can even look at detail here with regards to those, so that it shows what the cost is going to be before the deductible. And then after he hits the deductible, this is what his copay is going to be. And the reason it jumps so much, again, because 25% of this is supposed to be, I haven't run that on my calculator, but when I have done that, it comes out to the 25%. And you will notice we mentioned earlier about the insulin cap that kicked in during the current year. He's going to have a maximum out of pocket of the $35 for his insulin medication. And again, if he were to get into the catastrophic, he would have no copay. So that's the type of information that is available, and how we use the plan finder when we are working with individuals. So if all of that seems to kind of be overwhelming, That's what we're here for. Gary, have I left some points out that I might want to emphasize a little bit, or before we open it up for any type of questions folks might have?
Ben, I think you did a great job of explaining Plan Finder and how I think you really hit on the lowest cost premium isn't always the best deal. And so I think you really did a good job of showing how that's not always true. Sometimes it is, but many times it isn't. So comparing that total cost of the premium plus the drug cost is the way to compare. So I think that's the important part. The other thing about your Medicare.gov account is you're able to get a lot of your Medicare notices, see your premium billings, claims, and whatnot. So there's other benefits to creating your Medicare Gov account in addition to looking at just the drug and health plans. So just one more reason to go ahead and set that account up.
And one thing I might add then, Gary, is for those folks out there that are participating today, we have only looked at drug plans. And if I can get this out of the way for me, you notice that it does, if you are on a Medicare Advantage plan, the same thing is there, and I can simply click over. And it's going to show me then the Advantage plans that are available in this area. And again, it is going to rank them in the same way that it ranked the prescription drug plans. So don't feel left out if you're on an Advantage plan, because we use the tool exactly the same way to look at Advantage plans. And so it would allow you to compare your current Advantage plan again with all of the other Advantage plans available in your zip code, and showing the total drug premium and drug cost estimated for 2024. Do we have any questions in the queue? Anybody that has had something?
There are no questions yet in the Q&A or chat.
Okay. I guess we have covered it with a great deal of adequacy. I'm not sure. Let's go back then to the slide deck, and I'll stop my share. And obviously, we're done with that slide. So how do you make sense out of all of this stuff that we have gone through? Obviously, we would suggest that you call our 800 number, the 800-390-3330. What that means is you'll get in contact with our contact center, and they will collect some information from you and send that out to a volunteer like Gary or myself in the particular area of the state where you live. We can assist you with enrolling. We can assist you with billing issues. As you can see the list there, whether it has to do with Medigap or supplemental Advantage plan, prescription drug plans, the benefits, the savings benefits that we've talked about. If you have a problem, need some assistance with appeal, we do that type of thing. And one of the things that we haven't talked too much about in this particular series is the Senior Medicare Patrol, which partners with us in the state of Missouri. If you think there is some suspicion of waste or fraud that's gone on as you looked at your bill, that type of thing, why, we certainly encourage you to contact us, and we'll be sure that your information and you get in contact with the folks at the Senior Medicare Patrol to follow up on that and see if that indeed is a potential problem. One of the things that, if you're interested in some of the things like what we've been talking about and working with individuals and helping folks, we would invite you to consider joining our team, become somebody like Gary and I. that is a counselor, and we have an extensive training program that'll prepare you for that, mentors that'll help you walk through that process and become comfortable with becoming a volunteer counselor with Missouri SHIP. Other than thank you, I am out of verbiage.
And a question did just come across in the chat. Is there a benefit to enrolling in Medicare if you are 72 years old and disabled?
Absolutely. There are a lot of things there that could have an impact on that question. I'm assuming hopefully this individual is continuing to work and has visited with the folks at Social Security, gotten signed up for some type of Medicare benefit. I think this question kind of presumes that, well, let me back up and say at this particular point, if you are 72 years of age and you are not enrolled in Medicare, you need to call that 800 number before you go to bed tonight, so that we can begin to talk with you about some of the issues, because you needed to get enrolled at age 65. And if you were disabled, okay, the individual has been incarcerated. Okay, that's an issue that we definitely need to talk with the individual, because there are some special rules with regards to individuals that are have been incarcerated. So yes, it's going to be, well, it's just something. Yes is the answer.
And as a follow-up, could this individual have a support on the call with him?
From our perspective, that is not an issue at all. Sometimes when we are talking with agencies other than Medicare, yes, we have to have the individual on the call with us, but I have to have consent, that type of thing. But no, there is certainly no problem with an advocate being on the line with that individual.
There are no more questions. Thank you, Ben and Gary and Sonia. I did go ahead and launch the closing poll because I do realize we are at time. But if questions pop in as you're logging off, we will do our best to answer them. Have a fantastic day.
Thank you all.
Thank you all.
Thank you.